Good morning, everyone. Welcome back to another episode of the Wilderness Fitness Podcast. I'm your host, Dr. Rob Minturn, physical therapist, strength and conditioning specialist, owner and founder of the Wilderness Fitness Institute. Hope you guys are having a great Thursday, recording it this afternoon. Can't go live again. So if you guys are listening to this and you are not following me on Instagram, it would be super helpful if you were following me on Instagram so that way I can do these live and kill a few birds with one stone at the Wi-Fi Physio. That would be super handy. If you want to pause this podcast now and just do it because you'll forget at the end. If you're like me, you'll forget to do it at the end. So help me out by following me on Instagram. Anyway, today's podcast, it's going to be about moms. Mom is a noun. It is not a diagnosis. Okay. So let's just get on into it. So society norms shape mom out to be a diagnosis, not a noun, or it is more of a diagnosis and a noun versus just a diagnosis because it's definitely a noun. But we need to reframe the mindset. We need to reframe the whole framework of being a mom. And it starts with you as a human, and it starts with you with the 6 to 8 inches, 7 inches, however big your head is between the ears. It starts with that. So there's a few society norms that I want to go over and talk about, and then dive into each one of those. There's four of them. And so we'll unpack those and kind of go from there. Okay. So the first one is you're going to pee your pants forever. Okay. The second one is your sex life is going to change. The third one is you can't lose the baby weight. It is like it's going to be super hard for you to lose the baby weight. We're going to unpack that a little bit. And we'll even go back to like pre-pregnancy or during pregnancy guidelines for that. And then your kids come first, right? So your kids are above everything. Your kids come first. That's a society norm. So I want to debunk that, or not debunk it, but talk about that and unpack that. So the first one's going to be you're going to pee your pants forever. You certainly will if that's going to be your mindset and you continue to fall back on the excuse that you're a mom and that's just how it's going to be. If you don't deal with this, you're likely going to deal with hip pain and back pain as well because your pelvic floor is weakened. It's gone through a bit of trauma, whether you had a vaginal delivery or a C-section. It's still trauma to the pelvic floor, so you need to rehab that. If I were to shoot you with a 12 gauge in your pelvic floor or in your shoulder or any part of your body, you're going to expect some sort of rehab with that. It's the same thing with birthing a baby. It's the same thing with being pregnant. It's the same thing with a C-section. It's trauma to the area, so you need to rehab that so that way you don't pee your pants for the rest of your life. Because I walked down the pad aisle to do an Instagram reel, and I didn't want to be some weird dude just walking down the pad aisle taking his phone out and videotaping. So I made it quick, but I glanced at the price, and that shit is not cheap. And I would much rather be putting that stuff towards gear, or as a woman, I'm sure you would much rather be putting that stuff towards gear, towards your kids. Towards your spouse, towards something fun than having to put it towards your pads. So you could take that money. Initially, it's going to be an investment up front, but you could then take that money that you're putting towards pads and incontinence tools and put that towards a gym membership, and that's going to be well worth your investment, and it's going to be well worth your time. Um, with peeing your pants forever, you need to go against societal norms. You need to go against what OBs tend to tell moms as well. That a lot of times the women that I work with are not coming in strictly for this is more in person. I'm speaking like on my travel contracts, but when I have a woman coming in with low back pain, with hip pain, even knee pain that has hip involvement. I'll be asking about pelvic floor stuff because typically, if someone's dealing with knee pain, they're going to be dealing with hip and low back pain as well, is from what I've noticed. So then the pelvic floor discussion comes into play. Um, but a lot of times these women, and it might be a generational thing, because pelvic floor physical therapy, women's health is starting to be on the upward trend, which is good. But the older generations, it wasn't really a thing, and they were just told that they were, that's how it is, they're a mom. So they don't really think to go in and get another opinion as medicine has advanced and as medicine has changed. So they just sit there and think that, this is the hand that they're dealt, and this is what they're going to deal with for the rest of their life. So I challenge you to not go with those norms, not go with maybe the first opinion of your OB. Find a fitness forward OB that is going to be supportive of you changing your lifestyle and changing your symptoms and supportive of you in starting down a fitness journey. That's the OB that you want on your side. Okay. Um, There isn't. So again, with the societal norm of peeing your pants, um, in therapy we have they're called ICD-10 codes. It's basically a diagnosis code that we use for billing purposes. To my knowledge, there is not a code of mom. If you're watching this on YouTube or on Instagram, the replay, I did air quotes there. There's not a code of mom. We have low back pain, we have incontinence, we have pelvic floor pain, we have knee pain, we have pain in the right shoulder, we have like stiffness of the right shoulder, we have difficulty to walk, we have generalized weakness. We have a lot of different codes. Mom is not one of them. So if someone in the medical field is telling you, well, this is what you have to deal with for the rest of your life because you're a mom, um, there are far and few things that I think are going to be falling under that category that you just have to deal with for the rest of your life because you're a mom. Don't allow that mindset. Don't allow that societal norm to be dictating your life there. Okay. Point number two. Your sex life is going to change. This may change in the short term, right? There's a period of time after pregnancy and after delivering that you should not be having sex, but in the long term, you can get back to pleasurable sex. You can get back to a fun intimacy life and in an enjoyable intimacy or intimate life. Contributing factors to this may be a C-section with an emergency hysterectomy. That could have something to do with pain up front, right? It feels sharp. It feels like a knife. It feels like a crown of thorns. It's not fun at all. It's not good at all. When you didn't have that issue before or at all during pregnancy. Some of that might be a little desensitization to that area, maybe some stretching to that area, and then retraining the brain that, hey, this like it's not a painful stimulus. This is an okay stimulus. So there might be some psychosocial component to that pain as well. An emergency hysterectomy, but it's something that can definitely be worked on. Okay. Another consideration with the sex life changing is the vaginal birth, especially if there's tearing and possible sewing. There's different grades of tears. Sometimes women have to have their vagina sewn back together because there's so much tearing. So there is hope for the women that the ladies that go through that. Again, it's going to take a little time, a little effort, and some discomfort, but I think that's well worth your time to invest in yourself like that. So that way you don't have to have lifelong painful sex, or your intimate life with your husband does just ceases to exist, right? It's a long time. Lifelong is a long time to deal with that when short-term discomfort could improve that to the point where you can do what you want to do without having any sort of symptoms. Okay. As far as prevention goes, so preventing the perineal tearing, there is a perineal massage. Sorry, perineal massage. I'm saying that wrong. Perineal massage. Um, and you can start doing that around 34 weeks. So what that is, it's going to be basically you stretching out your vagina. That plain and simple. I'm not going to sugarcoat it. That's just what it is, right? And there are different tools. You could use a tool to do that. You can use a dilator to do that. You can also just do the massage yourself. You need to cause some discomfort. Unfortunately, that's just how it is, right? You're taking the tissue in the area. Like if we're going to be healthcare about it, we're just going to take the tissue in the area and open it up and it's going to help desensitize the area. Two, it's going to create a little more elasticity to the area. Um, Three, it's going to uh, help with the need for analgesics. Women who do this tend to need fewer analgesics. Analgesics are pain relieving modalities, pain relieving tools, I guess. The epidural, any sort of pain medication while you're there through the IV, orally, whatever, or however you need to get the pain relieving medication. But women who do this tend to need less of that. All right. So what the perineal massage is yeah, sorry, I'd explain what it is. It's basically opening up the vagina a little bit and improving the elasticity there. What you need to do with that or the duration. So you're looking at 3 to 4 times a week for about 4 minutes a time. This is according to a research study. This is what they had their participants do. Or you can do 10 minutes a week, right? So maybe um, 5 times for 2 minutes, or you can do 10 minutes all at once, or maybe you work your way up to it, right? You do 2 minutes 5 times a week. And then the next week you do, God, 3 minutes 3 times a week, and then 4 minutes for 2 or 3 times a week. So then you just continue to bump up to that 10-minute mark. You can certainly go that route too. Okay. So you got some options there, but you don't need to make it excruciating. Discomfort is fine. Don't make it super painful. As your tolerance improves, your ability to do that massage and do the opening is going to improve as well. Okay. But start that again around 34 weeks. Um, all right. Mantra number three is you can't lose the baby weight. You've tried and tried. You've done all these fad diets. You've done all these like keto diets, the Mediterranean diet, all this stuff, and you just can't seem to lose the baby weight. Losing weight is simply a numbers game. I did a podcast on this a couple podcasts ago. It was you can't ride two horses with one ass, performance or weight loss. So I touch on weight loss in there. That would be if you're struggling to lose baby weight, that would be another good podcast for you to listen to. It's just a few episodes back. But not being able to lose the baby weight, let's rewind to during your pregnancy. So caloric needs during or by trimester during your pregnancy. So with the first trimester, there's no change in caloric need, right? I don't have kids and I have never I'm not a dad by any means, so I've never been around like a pregnant woman on a day-to-day basis. So I don't know what this is like. I don't know when the cravings really start. But in that first trimester, whether you have twins or whether it's just a solo kiddo, there's no increase in caloric need, right? So despite the fact that you might have some urges to eat more or anything along those lines, there's no physiological change that you need to adapt for. Your second trimester, if you're having one baby, it's an extra 240 calories are needed. If you're having twins, another 700 calories are needed. In your third trimester, 450 extra calories are needed. And then 700 calories again are needed if you're having twins in that third trimester. Breastfeeding, there's a range of 3 to 500, depends on how much milk you're producing, there's going to be a few factors there, but you're going to be likely seeing or getting help with the breastfeeding initially and having some coaching there. So talk with whoever your coach is or your provider is on that about as far as breastfeed or caloric needs while you're breastfeeding. Okay. Again, and these numbers are just like they're concrete numbers here, but everybody's different in the caloric need, their body fat percentage, their muscle mass, activity level. It's gonna depend, but strictly based off of an extra human being grown within you or an extra two humans being grown within you. These are the numbers to sort of go by. Okay. Um, Another thing, like when you can't lose the baby weight, let's rewind to pre-pregnancy and during your pregnancy again. All exercise is safe for mothers without contraindications. If you have a very simple, straightforward pregnancy, your goal should be whether you are active or not, you can still exercise during your pregnancy. How hard you go and the intensity in which you go is going to be dictated on how active you were prior to. Okay, so if you're listening to this and you're pregnant, newly pregnant and you weren't really active before as far as exercise, you might have been doing gardening and going for walks and all that stuff, but you weren't really exercising. You're going to want to keep your exercise to a low to moderate intensity. If you're someone that's used to doing CrossFit, someone that's used to doing some heavy, or not some heavy lifting, but heavy lifting, weight training, that sort of stuff, you are definitely safe to continue to do that throughout your pregnancy as long as you don't have any contraindications. Speak with your OB, speak with a fitness forward OB who promotes a healthy lifestyle and promotes exercise, because that's where you're going to get the most honest opinion, or not opinion, but recommendation. Okay. And the most accurate recommendation. As far as, sorry, you want to accumulate 150 minutes per week of that low to moderate exercise intensity. You should be exercising at least 3 days a week to accumulate that 150 minutes. But if you want to spread it out to more days in the week, you certainly can do that. Cardio and resistance training combo is going to be super important because you want to maintain strength throughout this. You want to maintain or even improve your strength throughout your pregnancy. You want to improve your cardiovascular fitness throughout your pregnancy as well, because that's going to just set you up for a more successful postpartum phase and hopefully a shorter postpartum phase and shorter postpartum depression, and hopefully maybe even not experience a postpartum depression. So it starts with your pre-pregnancy and during your pregnancy, though. Set yourself up for success. Don't wait until you're done being pregnant after you have your kid to start exercising. You can certainly start exercising while you're pregnant. You just need to keep it at a low to moderate intensity. Okay. Um, as far as the cardio and resistance training combo goes, if you guys have been listening for any length of time, you know that I am very big on promoting gym memberships and or having a home gym, with a good amount of equipment so that you can have variety with your training and with your workouts. So one bit on that is almost all pregnant ladies experience some sort of musculoskeletal pain while they're pregnant. Musculoskeletal being basically pain throughout the um, joint, bone, muscle, whatever you want to think about, or however you want to think about that, right? So most women experience that. 25% of you ladies experience pain so bad that it does become debilitating to some degree for some sort of length of time. Okay. So that's a decent percent, like 1 in 4, right? You've probably got at least four friends or three other friends that are pregnant that have been pregnant. Think probably one of the four of you have experienced pain so bad that you've not been able to get out of bed or get off the couch or get out of the recliner or something, to the point where that's your life has been greatly dictated by that. Um, your cardio and your resistance training is going to help prevent that from happening, right? You don't have to be part of that statistic. So, the last little bit of the social stigma, the social norms, is going to be that your kids come first. And understand, and I mentioned this earlier, I don't have kids. I've never been around a pregnant lady for very long. The most I've had some friends that were pregnant, so they stop by and say hi, and some patients, but it's never for any sort of length of time. Okay, so. With that, you're getting strictly a healthcare provider's opinion, not a dad opinion. So when I say that your kids come first, I have on here, no, the fuck they don't. Okay. You and your husband need to come first in terms of your health. You guys have to take care of yourselves. You guys have to team up and help each other take care of yourselves, right? If you guys are not healthy, if you guys are sick all the time, how in God's name are you going to be able to take care of your kids and provide a quality life for your kids if you guys are constantly trying to play catch up with your own health? Running to doctor's appointments for your kids is enough. You don't want to run to doctor's appointments and run to your appointments, or even worse yet, run to doctor's appointments for your kids, and then continue to put your health and your appointments off because you're spending so much time with your kids. It is much easier to prevent issues for you because you're going to be busy with your kids. So spending 30 to 45 minutes a day, 30 minutes to 60 minutes a day, or even a few times a week is going to be well worth your investment there. Okay. But your kids cannot come first. I mean, you have to make sacrifices because you have kids. But again, your life and your lifestyle should not be totally changed and dictated because you now have kids. The way that you do the things that you like to do, right? You like to hike, backpack, be outside, that sort of stuff, go for bike rides. It's going to be dictated by the fact that you do have kids. It's going to look different, but you should still continue to be active and do that stuff. I know that I've got some friends that sort of fine with their kids that I think a month old, 2 months old, because that they enjoy traveling. They had to go home for the holidays, and so that they just flew home and made it happen, right? Where there's a will, there's a way. So if you want to improve your life and get back to that active lifestyle that you were doing beforehand, there's minimal reasons that you shouldn't, right? And working with a physio, working with someone like myself, working with me, we're going to find a way to get you to be active again. We're going to reduce those barriers so that way you don't have a ton of barriers in your way to get you healthy again and get you active and feeling good again. Okay. One tip for with kids that I think has been pretty successful with parents that I've worked with, especially new parents that I've worked with in the clinic and online with this. Is creating time for that workout, right? Like I said, you were working out beforehand. You may have been someone it was like wake up, go to work and wake up, an hour, 45 minutes before you had to leave for work, do your thing, get ready, make breakfast, go to work, come home, work out before you get home, and then hang out with your spouse, and then do your thing, go to bed. Obviously, that's going to look different with a kid. So you might have to make time before they wake up, right? You might have to get to the gym. One of you gets up early and goes to the gym, and then one of you goes to the gym after work, right? You might not be able to work out together anymore. But again, you're still working out. So tag teaming that either before they wake up or when they on the way home from work, tag teaming when each one of you is going to work out is super important, or is it not super important? It's a super good way to maybe diversify and conquer with your workouts. Another thing that has been wildly successful is actually including your kids on some of the workouts. It could be as simple as going for a walk after work, probably after work, before or after dinner, or maybe before dinner. You might do some interval style, like if you had to do like some sprint training or some interval style training, you include them on those intervals, right? They can sprint, they can run, they can do all those things if they're old enough. So bring them with, right? If they're too young to include them in on that stuff, bring them outside and have them hang out in the baby carrier or sorry, not a, yeah, baby carrier, stroller, playpen outside while you do sprints up and down the sidewalk. Be creative with what you're doing, but certainly don't just exclude them all the time because they can't do exactly what you're doing. Incorporate them, and your workouts may look different, but at least you're getting a workout in. Okay. And then the last little bit is establish an earlier bedtime so that way you've got time in the evening to work out, hang out, flirt, date your husband again. Okay. Uh, Establishing that earlier bedtime may be a little difficult, especially if your kids are used to going to bed. You're listening to this and you think it's a good idea. Your kids are used to going to bed at a certain time and you want to put them down maybe a half an hour, 45 minutes earlier. That might be a little difficult at first, but uh, that might give you a little more time in the evening just to decompress and relax, which would be super important for one, stress management, but two, also your physical health, to give you a little bit of time to work out before bed. Um, I always tell my clients, I do not care when you work out. It does not matter to me as long as you're being consistent. So what you do consistently will always trump what you're going to do sporadically. So if you can do a solid 3 workouts a week in the evenings when both you and your husband are home, and your husband can put them down, and then you can go do your thing in the gym. Do it, right? Do that and over and over again, and eventually those results are going to happen. But if you think that you're going to do it 5 days a week after your kids go down, you're super motivated, and you get knocked off the rails even once or twice, it's going to be super hard to restart that habit again. So set yourself up for success. Be realistic with how often you're going to do it, and then just build upon that once you're successful with that. Okay. Clinical bottom line. So in summary, being a mom is not a diagnosis. If that's how you viewed it or what you've fallen back on when shit goes wrong, you need a mindset framework reset. Okay. You have to start thinking differently. The lives of the clients that I've worked with are dictated by their kids in multiple different ways, and they figured out a way to not allow their kids to put their health in the 18th back burner. I don't know why I chose 18th, but that chose 18th. You either make time for your fitness now, make time for your health now, 30 to 60 minutes each day, or 30 to 60 minutes 3 to 4 times a week, accumulate that 150 minutes, or you get to make time for appointments later. You're going to hurt picking up your car seat. You're going to hurt uh, just sitting on the couch. You're going to have neck pain to the point where you have to use icy hot or TENS unit, or you have to go get some sort of dry needling done um, just to get through your day, right? At some point, now you're going to have to tote them around to your appointments. You're stressed out because you can't concentrate on yourself. Your kids are screaming. Your kids are going all over the place during your appointment. You really can't concentrate on yourself yet again. And you have an unsuccessful session, and you're just in that rat wheel, right? Spend the time on yourself before things really start to go downhill, because that downhill slide is fast. Mom is a noun. It is not a diagnosis. If you guys found this episode helpful, subscribe to the podcast, send it to another mom who needs to hear this so that way they can get their life back on track. This might be one little motivating factor to get them going. Sometimes people just need a little nudge from somebody in the healthcare space to give them permission to make that change. So send this to them, or send it to a husband who's not supportive of their mom or of their wife taking their health back and giving them the time and space to do so. Sometimes that happens too. I've worked with a few moms that their husbands aren't really supportive of them changing the lifestyle and wanting to live a healthier lifestyle now that they have kids. So send this to a husband or a boyfriend or a fiance, wherever they are at, the dad. Send it to them if they need to hear a little wake me up, so that way their spouse can or significant other can start to live a healthier lifestyle. Anyway, hope you guys have a great rest of your Thursday. I will catch you guys next week. Peace.